Hey guys, I'm Dr. Ben. If you are somebody that suffers from headaches or migraines, I'm going to show you how to fix that right now. Specifically, I'm going to talk about somebody who's got that headache that goes from the back of the neck and the head all the way behind the eyeball. Maybe it's over in the temple, or maybe you're somebody like Jennifer, one of our patients, 22 years of migraine headaches, literally fixed them within 2 weeks, hasn't had them in 6 years. So let me explain to you how this works. So the way that your body works, of course, you all know that your skull is right here, and we have 7 vertebrae in the neck, and I'm only going to draw a couple of them here. But why this is important is there is a nerve that actually comes out of the neck and controls it goes behind the eyeball, the ear, the temple, and that's your main headache nerve, right? It comes right over here. It's called your greater occipital nerve, right? And it innervates your head and all that fun stuff. Now, the problem is that you've also got all these muscles in the base part of your skull, right? We've got 2 muscles here, one that goes like that. We got one that goes like this. Then you've got another couple muscles that come down and they hook onto the edge of this and over to the neck. It's called your suboccipital triangle. Now, the problem here is that this nerve gets hooked. Right? If we're somebody that gets stuck on our computers, maybe you've had whiplash, maybe you're like, we even see with like kids, they get stuck sideways in the womb, they wind up having this trauma to these muscles. And what happens is that those muscles will actually hook onto that nerve. So let me explain this to you. Right? Your muscle fibers are supposed to all run in a direction like this, okay? And that's normal. The problem is when we damage these muscles, we spend too much time on the computer, too much time driving, you'll actually will damage that muscle. Now it's really common, your body, when you damage it, your body puts essentially scar tissue in there. It's like super glue, and it winds up fixing that muscle. It glues it, so those muscle fibers that are supposed to be able to run back and forth like this, they get jumbled up, and that's normal. The problem is as your body's trying to heal that and it lays down that scar tissue, it oftentimes will hook into one of those nerves, okay? And it'll develop scar tissue around that nerve. If this is you, by the way, this should start sounding familiar. So basically what happens is that muscle gets hooked onto that nerve. So when you spend the day on the computer, that muscle will spasm out and it will pull on that nerve, right? And it'll cause headaches, it'll cause migraines. Again, Jennifer's one of our patients, 22 years of migraines. We unpinched this, we freed this up, and literally within 2 weeks, hasn't had a migraine in 6 years. She's not the only case that we have of that. We've seen thousands of cases of headaches going away, because what we need to do is we have to strip that nerve out of that muscle and adjust it. It's not something that's painful, it's not difficult. By the way, we have so many people that'll wind up getting Botox injections. You probably have heard this, that for their headaches, they'll get these Botox injections and it doesn't fix anything because the nerve is glued to that muscle, and actually that Botox injection actually makes it worse. And by the way, you know this, if you push right here, when you're having a headache, if you can push in the back part of that neck, and usually up top here, you push here, and you'll feel it. It feels like, oh man, something's just not right. That's often what this is.